Hey doc, it's Nick. You have this patient that was having some discomfort between 29 and 30, and we were able to obtain a CAT scan. And what I wanted to do is just kind of walk through what I'm looking at when evaluating these. Before I take a look at that, I'm always going to assess the overall situation of the visible data. The reason for that is I want to make sure that there's no pathology surrounding that might be unrelated to the area of focus. No different than when we send these to oral radiologists, they go through with a fine-tooth comb and they look at everything. So, as we enter the era of CAT scans being a mainstay within dentistry, it's impractical to send every single image to an oral radiologist. With that said, it's important that we understand that the information that we gather is properly diagnosed. So we are responsible for the information that's in there. So I always go through and make sure that I'm trying to look for aberrations. The more and more that we look at these images and these image sets, the better our eye gets at it. No different than we found things in 2 dimensions that we maybe didn't see the first time we looked at a PA. But really, we want to take a look at number 29 and 30. So, there's all kinds of different ways of evaluating this, but I'm looking at kind of this area right here, which is not too dissimilar from the information that we get on a PA. One thing I do notice is a little bit of condensing osteitis around the distal root. The endo looks good, looks like it was properly obturated. 29 looks somewhat sclerotic. Maybe that's contributory. Well, maybe it's not that bad. General widening of the PDL, so I can tell this patient has a decent amount of parafunction of some kind, whether it's clenching or bruxing. Evidenced by the number of crowns this patient has. There's definitely a biomechanical aspect to this patient's set of issues. But what's nice here, there's 2 views, or really 1 view that we get that we don't see with a conventional 2-dimensional x-ray. One is the axial view. So when I scroll up and down, what I see that's rather evident is this area right here. And this is the, looks like the mesiolingual root. Let me go ahead and zoom in here. This is number 30, so here's the 2 mesial roots and here's the distal. It doesn't look like there was a canal that was missed. Sometimes when I see these radiolucencies, I'll look for missed canals. My gut tells me that everything was cleaned properly. If it was a missed canal, I'm not sure we would see it to this extent. This looks like it extends from the crest of bone, which is right here, right in this area, all the way down to the apex. So this is a J-shaped radiolucency, and to appreciate this a little better, if we come over to custom reslice and then go like this, we get this image here. To me, this image is the one that really tells us what's going on. This is obvious. Now, it's not obvious on a 2-dimensional x-ray because we don't have access to this view. So it looks like this tooth is cracked. J-shaped radiolucencies occur in other dimensions, not just the dimensions we see in 2-dimensional images. If this had continued long enough, we would eventually see some sort of J-shaped radiolucency on the 2-dimensional image. But this patient's symptoms prevented us from getting to that point, which is probably a good thing because we don't want to have the patient in pain, and we don't want to have too much bone loss. So this custom reslice works really well. You can move it like this to get a better sense of what's going on. And without a question, we're kind of in that area between 29 and 30. So unfortunately, because this is pathognomonic for a vertical root fracture. The two should come out, as I'm sure you know. But it's this view here that the CAT scan gives us that we would not be able to see otherwise. So we save the patient from going to the endodontist. The endodontist may or may not have access to the CAT scan. Maybe the patient goes to the periodontist. We're very much able to kind of hit this at the pass and get the patient the treatment that they need. So I will leave it there. Let me know if you have any questions.